So I am very happy to share with you the results of WEBCAST and WEBCAST 2 studies. So I show you this to show you the evolution of the device, but we all know the evolution of the device. At the beginning, we have the DL version, followed by the SLS SLS version, followed by the SLS EV version, enhanced visualization version, and finally the 21 and the 17 system. What is important to consider here is that WEBCAST was evaluating the first version of the device, which was the DL version, and WEBCAST 2 was evaluating the SLS EV version. So it means that we were really conducting an evaluation with WEBCAST and WEBCAST 2 at the beginning of the clinical use of the web device. So you have here the summary of the all studies, but I will skip this because we have too many information. What were the studies characteristic for WEBCAST, WEBCAST 2? It was both of them were single-arm prospective multicenter studies conducted in Europe. On the clinical and the imaging follow-up was collected yearly up to 5 years, which is effectively very important to know what is the stability of the treatment. All data collected were 100% monitored. All adverse events were independently evaluated, by the way, by Andy Molineux. All anatomical results were independently evaluated by a core lab, and the core lab was James Byrne. We were using the LOCF method for analysis, which means that when some data we are missing at 5 years, we were using the last data we have for the patients to evaluate things. So here you have the study flowchart. The study flowchart is relatively simple. At the beginning, we had 106 patients on aneurysm, and 5 patients were finally withdrawing consent, and also 5 patients were not treated with web. So these 5 patients were excluded indeed for anatomical analysis because they don't have a web placed in the aneurysm sac. So these results were very recently published online in JNIS in July 2022. So I will start with web safety, which is indeed very important. Here we have the safety population, nothing special. You see the mean age was 54. The gender was mostly female, 68% of cases. And you see that the mean safety long-term follow-up was 50 months. So when we look at the mortality at 5 years, you see that the overall mortality in this series was 7%. By the way, don't forget that in the WEBCAST, WEBCAST 2, we will see the number later on, but most aneurysms were unruptured aneurysm. What is important here is to see that the mortality is 7%, but there was no web-related mortality at 5 years, 0%. There was 1% procedure-related mortality, which was in fact related to an hematoma at the puncture site, and which was responsible for the death of the patient. Otherwise, all mortality was related to other conditions like cancer, cirrhosis, etc., etc. So finally, a very limited mortality even at 5 years. When we look at morbidity, it's the same. You see that we have only 1% mortality, not related to the procedure, not related to the web treatment, but related to alcoholic neuropathy. So nothing to do with aneurysm and its treatment. Now, when we look at web efficacy, here you see the location of the treated aneurysm. You see that the most frequent location treated in these 2 series, WEBCAST, WEBCAST 2, was MCA, 51% of cases, followed by ACom, followed by basilar artery, and finally ICA terminus. The mean size, you see that they are relatively, they are not so small aneurysms. The mean size of the aneurysm is 7/3, and you see that most aneurysms were wide neck aneurysm, 83% of them. And I said before, you see that there was a relatively limited number of ruptured aneurysms, 7.4% of aneurysm. The mean efficacy long-term follow-up was 53 months. So when we look at the anatomical results at 1 year, you see that complete occlusion was obtained in roughly 54% of cases. And when we look at adequate occlusion, you see adequate occlusion is complete occlusion or neck remnant. You see that the rate of, we see that the neck of adequate occlusion is 80% of cases. Now, when we look at the result at 5 years, you see that we have more or less the same results, which means we have a complete occlusion in close from 52% of aneurysm, and adequate occlusion was obtained in 78% of aneurysm. Something interesting is to look at the evolution between 1 and 2 years. So we can do this analysis in a subgroup of 49 patients having a long-term imaging follow-up and not retreated. You see that at 5 years, the status of the aneurysm occlusion in this subgroup is complete occlusion in 57% of cases, neck remnant in 31% of cases, and aneurysm remnant in 12% of cases. So adequate occlusion in this subgroup of patients was obtained in close from 88% of cases. And now when we look at the evolution, you see that treatment was stable in 73.5% of cases, was improved in 14% of cases, and was worsened in only 12% of cases. But when you look in details the worsening, you see that, okay, most of the worsening was an aneurysm moving from complete occlusion to neck remnant in the majority of patients. There was no change from complete occlusion to aneurysm remnant, and there was only one neck remnant moving to the status of aneurysm remnant. So you see that the evolution between 1 year and 5 years is very good with a very stable treatment. So now when we look at the retreatment, which is something also important, you see that most of the retreatment were done for aneurysm remnant, which is not a surprise. There were 11 patients who were retreated. The timing of retreatment, you see that most of the retreatment were between the index procedure and 2 years. After 2 years, there were very few retreatments. So we have an overall retreatment rate of 11.6%. You see that a lot of modalities of retreatment were used: stent-assisted coiling, surgery. We know that surgery is feasible after web aneurysm treatment because you can easily place a clip and compress web if necessary. There was also retreatment with web and stent, flow diverter, web, and stent alone. So a lot of different retreatment modalities were used in this WEBCAST and WEBCAST 2 series. So just to show you very few illustrative cases, here unruptured ACom aneurysm treated with web SL 5/3. You see at the end of the treatment we have it's a position of the flow diverter of the web at the end of the treatment. It's a 1 year DSA showing complete aneurysm occlusion. We have 3-year MRA, 5-year MRA showing complete aneurysm occlusion completely stable. Here, another example, MC aneurysm treated with a web SL 7/3. You see that at the end of the treatment, we have a small neck remnant, and you see that the evolution is quite stable at 3 year, 4 year, 5 year. So in conclusion, you see that there is a high safety of web aneurysm treatment, and this high safety is confirmed at long term with a mortality which is 7% in the global series, but with 0% of mortality related to web, a morbidity which is 1%, again 0% related to web aneurysm treatment, and also a great efficacy of web aneurysm treatment with adequate occlusion in 78% of cases on a low retreatment rate of which is close from 12%. Thank you for your attention.